Hi, I'm Matthew Darlitz. I'm the Editor-in-Chief of the Science of Psychotherapy, and I'd like to introduce you to this new series of videos that I will be doing. Now, in this series, I'll be covering psychopathologies and other mental health issues as a sort of reference guide for psychotherapists. I'll be defining and explaining issues, as well as what can be done in these concise, short videos, primarily for awareness. There's only so much that I can cover in a few minutes, and hopefully inspire you to do your own research and to discover more. Now, these are often sensitive issues for people impacted by mental health conditions like this first topic of intellectual disability. And in no way are these videos meant to be therapeutic or counseling, but rather a cataloguing of the myriad of conditions that a psychotherapist is likely to encounter during their career. I'm going to be speaking relatively quickly in this series, but there'll be captions. And of course, the beauty of video is that you can skip back and, replay sections that you didn't catch the first time. So let's get started by defining intellectual disability. An intellectual disability is a type of developmental disability that affects a person's ability to learn, communicate, and problem solve. It is typically diagnosed in childhood and is characterized by significant limitations in intellectual functioning and adaptive behavior, which are skills that are necessary for daily living. Intellectual disability can range from mild to severe, and the specific signs and symptoms can vary widely from one person to another. Some common signs may include delays in achieving developmental milestones such as walking, talking, and toilet training, difficulty in learning new skills, adapting to new situations, and challenges with communication, socialization, and self-care. Intellectual disability is typically caused by a combination of genetic and environmental factors, such as prenatal exposure to toxins or infections, and complications during pregnancy or childbirth, and a person's genetics. While we are yet to find a cure for these sorts of pathologies, early intervention and support can help individuals develop skills and reach their full potential. This is a relatively common condition, and it affects people of all ages, races, and ethnicities. According to the World Health Organization, the prevalence of intellectual disability ranges from 1% to 3% of the general population. However, some studies have found higher rates of intellectual disability in certain populations, such as individuals with certain genetic conditions or those who have experienced trauma to the brain. Also, the criteria for diagnosing intellectual disability have changed over time, which can affect the prevalence estimates. So what are the most common intellectual disabilities? Well, there are several types, and these are relatively common, including Down syndrome. This is the most common genetic cause of intellectual disability. It's caused by the presence of an extra copy of a chromosome 21, and this was first described by a British physician, John Langdon Down, in the 1860s. It's characterized by a physical and cognitive delay, including developmental delays and cognitive impairment. Secondly, we have fetal alcohol syndrome, and this is a condition caused by exposure to alcohol during pregnancy, and it can lead to a range of physical and cognitive abnormalities, including intellectual disability. Thirdly, we have autistic spectrum disorder. Now, this is a developmental disorder that affects communication and social interaction, often accompanied by some form of cognitive delay, but we will talk more about autism in a separate video. Fourthly, we have Fragile X syndrome, and this is a genetic condition that is caused by a mutation of the FMR1 gene, and it is the most common inherited cause of intellectual disability, and is characterized by developmental delays, cognitive impairment, and behavioral problems. And then we have other causes of intellectual disability, including trauma to the brain, infection during pregnancy or childbirth, malnutrition, and severe neglect or abuse. Now, you might be familiar with Phineas Gage, who sustained a severe brain injury in 1848, and he's a famous example of a cognitive impairment due to a brain trauma. And in the case of neglect, there's the famous story of Jeannie. Jeannie was a child who was subject to severe abuse and neglect during her early years, resulting in a significant cognitive and developmental delay. Jeannie's case is one of the most well-known and widely studied cases of child abuse and neglect in psychology, and it's helped researchers understand the long-term effects of abuse and neglect on cognitive and social development. Jeannie was born in 1957 in California and was the youngest of 4 children. Her father was abusive and authoritarian, and he kept Jeannie isolated in a small room for most of her early life. She was not allowed to speak or make any noise, and she was severely neglected, receiving very little social interaction or stimulation. And as a result, Jeannie was unable to communicate or walk when she was discovered at the age of 13 in 1970. After Jeannie was discovered, she was placed in foster care and received intensive therapy and support. Despite her severe delays, Jeannie made significant progress in her cognitive and social development, and her case has been used as an example of the potential for recovery and plasticity in the human brain. So, what are the most common ways to treat intellectual disability? Treatments typically focus on helping individuals develop their skills and reach their full potential. Some common approaches may include early intervention. So early intervention programs can help children develop their skills and abilities at an early age. These programs may include therapies such as speech therapy, occupational therapy, and physical therapy. Then we have special education. Special education programs can help children learn and develop at their own pace. These programs may include individualized education plans that are tailored to the child's specific need and abilities. And then we have the use of medication. In some cases, medication can be useful in helping manage symptoms as a result of attention deficit hyperactivity disorder, ADHD, or anxiety. And then there's assistive technologies. Assistive technologies can help individuals with intellectual disability communicate and interact with the world around them. This may include devices such as computers or smartphones with special software to assist in communication. And then there's supportive services. So these are like counseling, vocational training, and support groups that can also help individuals lead independent and fulfilling lives. So treatments are typically lifelong. They may involve a combination of approaches, and the specific treatment plans are obviously dependent on the individual's needs and their abilities. So a psychotherapist can play a number of important roles, including providing support. Psychotherapists can provide a supportive, non-judgmental environment where patients with intellectual disability can talk about their feelings, thoughts, and experiences. This can be especially helpful for individuals who may have difficulty communicating or expressing themselves. We can teach coping skills. Therapists can teach coping skills to help clients manage difficult emotions or situations. This may include strategies such as deep breathing, progressive muscle relaxation, or problem-solving techniques. We can also help with communication. We can work with patients with intellectual disability to improve their communication skills. This may involve helping them develop their vocabulary, using gestures or facial expressions to communicate, or use assistive technologies such as communication devices. Supporting social skills. Psychotherapists can also help clients develop social skills and improve their relationships with others. This may involve teaching them how to initiate conversations, make friends, interact appropriately in different social situations. And we can provide guidance. We can provide guidance and support to patients with intellectual disability as they navigate challenges and make decisions about their lives. This may include helping them set goals and develop a plan for achieving them. So overall, a psychotherapist can be an important resource for individuals with intellectual disability as they work to develop their skills, cope with challenges, and lead fulfilling lives. Thank you for tuning in to the Science of Psychotherapy. Please like this video, subscribe to our channel, and hit that bell so that we can reach more people and bring you more Science of Psychotherapy. And if you're a mental health professional, check us out at thescienceofpsychotherapy.com.